Good morning, everyone. Today we have organized a workshop with PG students of various homeopathy colleges who are going to give us information regarding several aspects of immunity which has been responsible to get altered by different lifestyle factors. And this activity is a part of our AYUSH for Immunity campaign. And as we all know that this month is a month for Vihara, which means the lifestyle activities. And all of the students who are going to now keep their presentation will be discussing on several lifestyle factors which are responsible for altering the immune system. So with this,
Thank you.
I move on to the next speaker, Dr. Pooja Bhatt, and he will be delivering his lecture directly over the video. So no slide as such, but he will be directly telling us an important points, certain important points regarding lifestyle factors, which is affecting the immunity. Let us see what he has on her behalf. Dr. Pooja, over to you.
Oh, yeah, thank you so much. Hello everyone, I'm Dr. Pooja Bhatta, postgraduate trainee from the Department of Homeopathic Pharmacy from National Institute of Homeopathy. So today I'll be talking about substance abuse and immunomodulation, in which my main focus will be on alcoholism, tobacco intake, and few other drug abuses like opiates, cannabinoids, and cocaine. So this alcoholism and tobacco its intake is very much prevalent in today's society. From a certain age up to 60, 70, or even more than that, people are consuming alcohol every now and then. How it is affecting our immunity? So now there are various research evidences which suggest that it disrupts immune pathways in a very complex manner. What it does actually, it impairs the body's ability, first of all, to defend against infection. Second is, it contributes to the organ damage. And the third one is, like, it hampers recovery from tissue injury. If already there is any injury going within the body and the body tries to heal itself, there comes the alcohol which will prevent healing. So now if we see its effect, like it is affecting both adaptive immunity as well as the innate immunity, and it is reducing or weakening the host defenses. For the chronic drinkers, it is creating a wide range of health problems, starting from getting infected by different bacteria, viruses, or also contributing in the systemic inflammation. So if we see the organs mainly affecting, we all know that alcoholism, it is affecting our body as a whole. But from where it is starting, the first area where it is coming into the contact, that is the GI system. We are intaking it orally. So what happens? It affects the structure and integrity of the GI system as a whole. How it is doing that? We know that in our GI system, there is a gut microbiota. This alcohol, when comes in contact with this microbiome, it alters its numbers and its relative abundance in the GI tract. Now, we know that this gut microbiota is very important in the maturation and function of the immune system. And when it is getting affected by the alcohol, then there is a disruption. There is a disruption in the communication of these organisms and intestinal immune system. And with that, increased alcohol consumption, it is affecting the epithelial cells, T cells, and neutrophils in the GI system, and disrupting the gut barrier function. So what is happening because of that? If the gut barrier is disrupted, then there is leakage of the bacterial products from the gut, and it activates the immune system in the liver. Now, once the innate immune system in the liver is activated, it will trigger inflammation, which is an underlying important cause for development of alcoholic liver disease. And with that, if there is super added viral infection like hepatitis and all, then the progression of this alcoholic liver disease will be enhanced. Next comes after GI tract, I will be talking about respiratory system, like how this alcoholism is linked with various pulmonary diseases, including pneumonia, TB, RSV, that is respiratory syncytial virus, and also ARDS, that is acute respiratory distress syndrome. So, in short, if we want to understand that, we all know that in our respiratory tract there is cilia. Now, this alcoholism is mainly affecting the ciliary function. It is hampering that, and also the function of immune cells. That is, what are the immune cells in our respiratory tract? Different alveolar macrophages and neutrophils abundantly present in the respiratory tract. When it is affecting that, again there is weakening in the barrier function of the epithelia, and hence development of various diseases. Uh, what happens actually, like the symptoms because of this alcoholism, they doesn't get manifested until there is a secondary or superadded respiratory infection. And once there is a superadded respiratory infection, this alcoholism act as a enhancer, like it will increase development of these diseases, which is very relevant in today's scenario. If we go on, or if we go through different research article relating with the COVID-19, we will see that the people who were frequent intaker of this alcohol, complication related to COVID or respiratory complications were much more in these people than those who were not the regular intake of alcohol. With that, there is also neuroimmune activation because of alcoholism, which plays a role in the degeneration of the neural system. Increased alcohol consumption also affects our decision making, and it decreases the behavioral flexibility of us. So this is how alcohol is affecting our body as a whole. And regarding this immune modulation, I have explained few areas like how it is affecting the GI tract or respiratory system or neural degeneration and all. Second, I'll come to tobacco consumption. Now, like alcohol, smoking is also impacting both innate and adaptive immunity. What it is actually doing, it is playing a dual role. Like in the first phase, or at one part, it is exacerbating the pathogenic immune response, or it may attenuate our defensive immunity. So both are harmful. If the pathogenic immune response increases, then we are exposed to different types of pathogenical organisms, and or if it attenuates our defensive immunity, to fight with these organisms, our body has much lowered immunity. So what are the substance which we will find in this smoking? Like there is nicotine, carbon monoxide, nitrogen oxides, cadmium, and many other harmful substances are present. If we see phases of smoking, there are two phases. First one is vapor phase and the second is particulate phase. Now this nicotine, this is mainly present in the particulate phase, which is responsible for the immunodepression. And this all these substances, they are lipophilic in nature. So as they are lipophilic and our cell membrane is also lipophilic, like it is attracting, or all these harmful chemicals are very easily passing through the cells and they are causing different problems. So in adaptive immune cells, they are mainly affecting T helper cells, CD4, CD25, regulatory T cells, CD8, and also B cells. While the innate immunity cells, which are getting affected by smoking, are mostly macrophages and NK cells, that is natural killer cells. And uh, because of all these, our body is exposed to development of different diseases, be it respiratory system or cardiovascular disease or various infections. Even different types of carcinomas are also related with the smoking consumption. If we talk about autoimmune disorders, many diseases, RA, psoriasis, SLE, all these have much marked influence because of this smoking habit. And even smoking is very important factor in case of graft rejection. That also we need to keep in our mind. Now, next comes the other drug abuses, like if we talk about opiates or cannabinoids, that is marijuana or cocaine. So I'll be talking very shortly regarding this in a very short manner. Now, different studies, they have suggested that these opiates or marijuana, both are affecting immune system via, these are receptor mediated, and G protein coupled receptor are mostly involved in this. So what is happening? The main compound present in the marijuana, if we see, that is the tetrahydrocannabinol. It is one kind of cannabinoids. All the compounds present in cannabis, they are known as cannabinoids. This is also one type of cannabinoid which increases, like, it actually decreases our body's ability to fight with the infection. What it is doing, it decreases the lymphoproliferation, it decreases antimicrobial activity, and also it decreases cytokine production. So what is happening in few of the research study, it was found that in HIV infection, it increases the mortality, and the recurrent infection with the HSV, chances of recurrent infection also increases those who are regularly consuming these cannabinoids or opiate also, uh, regulating these all immunomodulation via receptor pathway, and the same problem is happening also with the opiates. And if we see, if we talk about cocaine, it was found that in vivo activity in human body, I'm talking about only human cells, in vivo activity, it is decreasing antimicrobial activity and decreased cytokine production. And if we talk about in vitro activity, like in cell culture and different cultures, with this decreased antimicrobial and decreased cytokine production, there is increased HIV replication also. So this is how all these substances, including alcohol, tobacco, and these drug substances, are modulating our immunity and exposing us to get infected by different infections present in the environment, or also responsible for developing different autoimmune disorders. Thank you so much.
Really, Dr. Pooja, it was again a very good, awesome presentation. Uh, you highlighted basically the substance abuse, medicinal abuse, and I think the main focus was basically alcohol, smoking, and over-the-counter drugs. And really, it's a very important issue because alcohol and smoking, it may be taken as a style icon at certain times by many. I think it's not that. It is not an essential nutrient you need to add to a diet. But many people add in their day-to-day activities, be thinking that it is something extraordinary, some heroism act, but it's not like that. And it's rightly highlighted, as you said. But starting with alcohol, if I say, the way you just went into the very detailed description, especially when you said regarding the pandemic situation, regarding the respiratory infection proneness, the susceptibility which increases. And later on, the COVID patient has been seen who used to have alcohol to have more complications, and highlighting those two important sphere, that is the respiratory sphere and the GI sphere, which is the main action for alcohol bad abuse, we can say, and which is as equivalent to the coronavirus sphere of action as well, because we all know that the respiratory manifestation and the GI manifestations is the commonest manifestation in coronavirus. We are more accounted with fever, cough, and shortness of breath, but we often forget at times that diarrhea, nausea, these are also presentation of SARS-CoV-2. So quite well matched. This portion has been quite well matched. I really need to say that it has been well calculated and well shown, especially with more references of macrophages, the immune cells, and then after that, tobacco consumption and the smoking part, which you highlighted. I want to pick it from the end, that is regarding the graft rejection, which you said. Many diabetic patients who may undergo graft rejection, go skin grafting due to diabetic ulceration, extreme stages of diabetic ulceration, or certain other patients due to certain other cause. If smoking remains as one of the factors, As we also know about Bartter disease also, this is a sole cause or the main cause of of the disease itself. So graft rejection was the important thing to highlight, which is also a part of immunity, because any transplant rejection which happens later on is also an immune modulating reason behind it, and graft rejection is also such thing, you can say. Apart from that, the smoking related the cells, the adaptive immunity, how it is affected to the T helper cells CD25 and CD8, well highlighted and well linked up. And also the autoimmune factors, which is created most often with smoking, that has been well illustrated as well. And at the end, the over-the-counter drugs, which basically contain certain cough products and certain sedatives, certain laxatives, painkillers, and codeine-based analgesics. So, which is very much taken by patients themselves without prescription over the chemist shop, and that's a very what to say, very day-to-day habit of the patients also. Means they try to go to the doctor when and until they can't do it by themselves. And what is that themselves remedy? Going to the chemist and buying medicines of like this sort. And they are really not aware of the long or prolonged use of this over the counter use of drugs. And that's why I think this portion really demands an extra applause from my side as well, because this needs an awareness to the patient or to any individual who just casually goes to the chemist shop and tell the name or ask the chemist to give certain drugs for this small causes which are not that small to be cured like this. So this relation with immunity was really excellently done, and highlighting how the phagocytic activity, the NK cell activity, and the cytokine products all gets diminished with the prolonged use of this opiate, this cocaine, or this kind of products. So once again, it's an awesome presentation.